So welcome everybody to Mindshifters Radio, and today is Friday, May the 15th, 2026. Welcome to the show. Everybody's a little late getting in. Michael's actually on conference in Asheville, North Carolina, and he just called me a minute ago and said he wasn't going to make it, so I'm on my own. I didn't have time to do a pre-recording, so you all get me today. So welcome. Glad you're here. I was interviewed on a podcast last night by Dr. Bart Rademaker, and I thought it went very well. So thank you for everybody who showed up for support. Appreciate it. And he's supposed to send me the video, so when he gets it to me, I will get it on our website and on our YouTube channel. So, has anybody got any questions or anything they want to share? Well, then I will just share, one of the things, the podcast is actually for medical doctors, but he's attempting to get them to look at things more naturally and to heal from the inside. He's got a really good vision for what he's doing. And, so I talked about my book, but it wasn't a platform for doing any selling or anything like that. And so I just talked about the healing process and how things do get passed generationally. And besides the story that I tell that came from a breath session where I saw myself as a Native American girl who had been captured and mistreated, abused physically, sexually, and had no hope of escape, and even actually welcomed death, which never came. And then out of that experience, I had tremendous hip pain and pelvic area pain. And it continued for years, even to the point that I sought medical testing to see, because I just knew something was wrong, and was told there was nothing wrong. And in a very real way, my life then has reflected the same pattern as that Native American girl. And I entered a marriage at 16 and experienced severe physical sexual abuse. And so I compared the two and how, was she an ancestor? And I was playing out the same patterns. And it was up to me to face and to deal with, to look at my own inner demons and how those patterns, we start identifying with them and thinking that's who we are. And then even in my book, I even go back just 3 generations, my grandparents and my parents, and the feelings that they had of needing to survive. And it was depression time and taking care of the kids. And my maternal grandmother, her husband had died when mom was just 18 months old. And then my paternal grandparents, they lived on a farm. They had 12 kids, and just trying to feed and make ends meet, and the survival and the fear of not being able to survive, and how that gets passed on down. And so it is a generational thing, and we deal with it, one moment, one step of forgiveness, one breath at a time. So in my book, I talk about all the thought distortions, the things that I thought about myself. And then later in the book, actually do a worksheet on each one of those thought distortions. And a lot of the worksheets are done on myself as, my carbon-based memory self, and the thoughts that were generated, and learning to let go and forgive and to just take a breath and be present. My go-to when stress was up was to dissociate, to actually leave my body, so to speak, so that I didn't feel the full impact of what was going on. But the body has memory too. It's not just stored in your brain cells, but things are stored throughout your whole body. And when you face and deal with that energy, then it moves through with the breath, and you can do the forgiveness work on what comes up, what you're holding, the false beliefs, and be free of it. And then your physiology can actually go back to health. My hip pain came back when I started writing the book and getting into the details and reliving the story. And then once I finished, the hip pain's gone again. So it's not physical. Now I know there are some physical things like, I broke my foot back in October. Rex broke his hand here just recently. So there are some physical issues, but we also have to look at what's underlying. The medical doctor, one of the things I pointed out was, and he had actually mentioned it first, that the culture is so trained to take care of the symptoms, to either give a drug or whatever. And that doesn't take care, it may relieve the pain, it may relieve the symptomology of it, but you have to go underneath and do your inner work to get ultimate healing. So I'll stop there. And again, just say thank you for those that were with us last night. And, he had asked me, what did I want the listeners to take away from the day? And I said, that they're not stuck being who they've been, who they think they've been conditioned to be, who they are, their false self. And that many of the patterns that we carry were learned through fear, pain, stress, and experience, or generationally. But with awareness and breath and forgiveness, that those patterns can be changed. We can actually, taking a breath gives you a pause, gives you a space to look at what's going on, be the observer, and instead of being wrapped up and involved in it. And so taking that breath and just being with it, feeling what's real. And people often try to deny it or say, well, I don't want to talk about it or think about it because then I'll create it. But if it's in your structure, you've already created it. And it'll keep showing up again and again until you're willing to look at it and face it and go through it. So, Susan, you came in late. So I was just saying Michael's in a conference in North Carolina. And so he's not with us today, but he didn't give me enough notice to play a pre-recording. So you all have me. So if anybody has anything to say or add or question or whatever, or if I can support in any way, I am here. Everybody's quiet. Everybody's just listening. Hi, Carrie. Go for it.
Oh, hi, Jeanie. Thanks for that little recap. And I didn't listen to the interview. I don't know if that's going to be available at
Yeah.
yeah.
Dr. Bart's supposed to send me the video of it. And so when he does, I'll have it on our website and also on our YouTube channel. And then I'll let everybody know when it's up. So yeah,
Oh,
he's going to
okay.
send. Yeah.
Yeah, so I'm really interested that, some of the traditional medical community is now exploring beyond what they see isn't working.
Right.
And um there there are still some who are not willing to entertain that. That's okay, but I'm just really heartened that there are some that are going outside of the paradigm.
Right.
And one of the things that I'm wondering about is, how the medical institution kind of views those doctors who go outside that paradigm. And if there's a backlash, I think there has been some
Yeah.
backlash in the past towards those doctors. But I'm curious, did he talk at all uh, about his mission at all and how he's going with that? Because
Yeah.
um, I follow, I go to traditional medicine when I've had a couple of surgeries, or when I need um, what the Course in Miracle calls magic. Um, and so I do magic healing. Um, and I also I have another doctor that I go to who works completely differently, all on energy, emotions, all that kind of stuff. And I get backlash for doing that. Um, so I'm just curious if he had thoughts about that.
Yeah, he actually mentioned that, and he said in no way was he putting down traditional medicines. Kind of like Michael says, there is a time when, the knowledge that the doctors have is amazing, and the technologies, and you may not know, but last May, I had a mass in my colon. I had a colon resection done, and the doctor did robotics. So I only had like small incisions in my abdomen. But he took about 5 inches of my ascending colon out, and it was not cancer. So, but he was willing to listen. Like at first, he said, that they would take my entire ascending colon. And Michael was sitting in the office and he's like, no, it's halfway up the ascending colon, and she needs her um, appendix and I think it's cecum and I don't know what all. And he said, she needs to keep that. He said, just take out the part that you need to on either side of the mass. And afterwards, the doctor was actually, Michael said he was excited. I was in recovery and he went out to tell Michael how it went. And he said, we were able to do what you asked. And so, he was willing to listen.
That's good.
Yeah. And I've done fun with that. I go for my 1 year checkup on that on Monday. But, we have a physician that, and it's been probably, I don't know, 15 years that we started going to him. And he's a regular medical doctor. However, he looks at the whole system. I remember the first time that I went to him, and he was doing the, entry exam, all over and asking, do I have any problems or whatever. And I said, well, there's one thing. I said, maybe I need to talk to a dentist about this. I said, I had this pain in my jaw. And he said, well, you receive energy from your left, you send from your right, and your right is your masculine. He said, you might want to look at what man you're holding back, not talking to. And it was like, whoa, And then there was another time that a friend of ours has one of these machines. You put your hand on it, and it supposedly reads your body and tells you everything that's going on and wrong with you. And she came back and told me I had breast cancer metastasized. And I mean, I immediately called him, and he said, Jeanie, he said, there is a big difference. He said, one, she didn't have a right, that's out of integrity to tell you something like that when there's not been any kind of testing and it's just going off of an energy machine. He said, energy can be passing through your system and that machine might pick it up. He said, but then for you to actually like grab a hold of it and make it real, he said, that's a different thing. And we were out of town, and he said, when you come in town, he said, come in, we'll talk about it. We'll, do an exam and all this. And it come back, everything's fine. It was perfect, but she definitely sent me into a panic for a while. And of course, that's my fear. But he also told me when we were talking on the phone before I got to see him, he said, the breasts have to do with nurturing, and cancer is anger. He said, you might want to do some worksheets around, and he's familiar with the worksheets. We've done workshops in his clinic, and he actually had Michael write the foreword for his book that he wrote. And he said, you might want to do some forgiveness work around, anger that you're holding inside towards yourself instead of nurturing yourself. And he said, when you get in a couple of weeks, he said, we'll schedule you, get you in here, and we'll check it out. And like I said, everything was fine. But when he started going, his clinic is actually called Integrative Health. And he has like Reiki masters and acupuncturists and massage therapists. He has what's the machine called? The oxygen machines that, oh shoot, I can't think of it. I started to say hydroponic, but that's not it. But it's a machine that pushes oxygen into your system. They use it in a lot of big clinics for cancer and things like that. He's got that. I mean, he's got so many things he does. He'll have people come in and just do hydration drips, if they're dehydrated, or he'll add, vitamin C to it or whatever. I mean, he's very out there, but like I said, he is a regular medical doctor. But he had to leave our local hospital, which is Ballad, and he's not in their system because of the way that he practices medicine. And
Yeah.
so, he still keeps on keeping on, and he has a great following, and everybody that he hires, all the, um, nurses and assistants and everybody, they're all on board with that same way of thinking. And so
Yeah.
it's,
So, they have to step outside of the
yeah,
traditional structure, like
yeah,
he was forced out, it sounds like.
yeah,
Um, but maybe that's okay. Maybe that's the way
yeah,
forward. I remember I first became aware of energy medicine about 30 years ago when I read a book called Coyote Medicine. And it was about this Native American who was doing that type of healing by that you did of, going deep within and looking at all the disintegrative energies that our mind creates uh, around things that happened. So working with our perceptions really,
yeah.
and I mean he did it a different way than Michael did with his tools, but um, so that was my first introduction to that. And I'll
It's
tell you,
awesome.
I have I have done some great healing um, through Michael's tools, some that have manifested physically. But I've also got a lot of things still going on physically that I
Yeah,
can't seem to shift. And I've done a lot of things uh, around that. I've done the QNRT, the quantum neuro reset technique, um, which involves eye movements and laser lights and affirmations and tapping and all that kind of stuff.
right.
And I've done Michael's worksheets. I've been to shamans. I've changed my diet. I've done homeopathy, and I'm still not shifting those physical things. And I've read books about people who heal from just breathing, okay, and heard people talking about that. So I've been doing a lot of breath work, and I still have these physical things that aren't shifting. I'm not feeling shifts or healing. Um, so I'm feeling a little despairing.
Well, like I said, there are times when the traditional medicine can provide some answers. They can provide direction. And just, when they offer something that, well, I think you need to do this. Like when I broke my foot, they wanted to put a pin in it. And I said, well, I'd like to do some other things and see if it'll heal on its own. And, the first month after I went back, it hadn't changed any. But the doctor was still willing to give me time. And then we started using, well, actually, that was it. The right after that was when we did the intensive here in Abingdon, and Urate had brought comfrey leaves. And so I was just in a boot and not a cast. And so I would put the comfrey leaves on the bone that was broke under my sock and changed it twice a day. And then Michael found a comfrey salve and ordered it. So I was putting that on it, and a couple supplements. One of them was, I think it's called horsetail, and, just different things. And when I went back the next month, he said it was like 25% healing from the inside. The outside of the bone was still showing cracked, but the inside of the bone was healing. And he said, we'll give it more time. And I went, I think 2 more times. And then finally he said, just call me if you need me. He said, it was looking good. It was continuing to heal. And he said, if it's not bothering you, he said, just continue doing what you're doing. So, I'm blessed that the times I've had to reach out to traditional medicine, that they've also been willing to listen to me too. And I think that's important. Listen to your inner guidance. If they offer something and say, you need to do this, then go inside and check, because all the answers are right there. But sometimes I use the example of my grandfather used to use horses to plow the field. And he would put blinders on them so that all they could see was what's right in front of them to keep them from straying and making a crooked road. And we're the same way. We have blinders of, maybe hostility and fear. And the answer may be right there, but we can't see it because our blinders are in the way. So, we have all the answers. It's just sometimes we're not listening. And so just go inside when they offer, you need to do this or that, and see if it rings true that that's the direction you need to go. And you'll be guided.
I also think I started to ask for guidance for other things, and I've had some amazing guided experiences. So I think I might try that with my body and my healing, because I haven't done that,
Yeah.
asking for guidance and seeing what comes, because I have experienced that, being guided in dramatic ways.
Yeah.
So yeah, thank you for that. I think I'm going to try that.
And if you have to revert to traditional medicine, don't beat yourself up for it. Be gentle with yourself and just listen and choose what feels right.
Oh, I do. I do. And in fact, it's my goal to get off some medications, um, so that I don't need them anymore.
Right.
Um,
What might be helpful, I have something I'd like to offer if I can, Jeanie.
Sure, Rex, go for it.
It's Carrie, right? Is who is
Yes.
talking? Carrie, you're probably addressing an age-old dilemma for those of us that are a little older and a little more aged. I don't know where you're at, but a little humor. I have played with things that have stayed consistent in my body and not gone away or healed, quote. And then I have played with other things that are actually quite severe that have healed. And there's so many levels of, I'd like to think, wisdom that I've derived from the experience of being engaged in repetitious patterns, whether it be physical, mental, emotional, or spiritual. And some of the things that I've learned might be helpful. One is I've mulled over and over and over again in my mind and my body how a cell that duplicates itself, and then also how cells in our bodies, in the course of what's estimated approximately 7 years now, we don't have any of the same cells that we had before, scientifically. And so how does a scar remain a scar? How does a scar remember that it's a scar? How does a
Oh,
body part
like
maintain?
a copy machine, it copies what was there.
It's like a copy machine. It copies what's there. But the component that I've found is helpful, I'm not saying I've got it handled at all by any means, but it's helpful, is to recognize that when I have an experience, two things that I do my best to remember as quickly as I can, to become conscious and remember that, to ask myself the question, what if this is what's leaving rather than what's still here? And have wisdom in that, and just pause and say, okay, if this is what's leaving, what if I re-engage it again as if it's still here?
Yeah.
Now I'm imprinting the cell and imprinting the memory in my body and mind and the whole system to replicate. And
Right.
so sometimes it's a matter of going, okay, hi. I'll use my back for an example. Hello, it's right here. Okay, hi, how you doing? And well, it hurts today. Oh yeah, I know, I get that. Okay. So is there anything I need to pay attention to? Crickets. Okay, not really. So other than just feeling the sensations of discomfort and pain or whatever I'm feeling, what I've found is if I'm just with the experience I'm having without identifying it as something that's happening to me, the victim reality, and I say, okay, I'm a creator, I'm a co-creator with creation, and I'm creating this experience for myself, consciously or unconsciously, in one form or another, generationally or not. It might be from something I said, thought, felt, and experienced yesterday, for heaven's sake. But ultimately, for me, there is a unfolding that's coming out of my system. And it's so challenging when it's pain and it's a repetitious scenario to have it be as if it's happening in the present moment, like it's occurring now. And what I'm trying to say is, and not doing an excellent job at it, is that it isn't something that in most cases that is happening right now. It's something I'm accessing, and I'm
Exactly.
accessing because I'm moving through it in most cases. But then I go, oh, darn, it's still here. That didn't work. And then I go, oh, I got to do another worksheet, which I may have to, and it might be it, but I'm going to do a breathing session. I've got to go see another healer. I've got to, and another piece with this is the consistent and constant looking for an external cause. It's another way of not so subtle and subtle denial for scenario. And I'm always looking for something outside of me that can, quote, give me the correction or fix it versus, wait a minute, what if it's not broken?
Right.
What if I perceive it in its wholeness as a discomfort or whatever it might be?
Sensation.
A sensation, yes. And if I'm able to experience it that way, now I'm able to go, oh, well, what if I just became love? What if I can be who I am truly and not identify with the situation I'm involved in, whether it be the sensations in my body or the pain or the discomfort? And I'm able to be an objective observer while fully witnessing and experiencing it. What I've noticed in most cases, the discomfort lessens, and quite often the symptomology can move to another part of my body or just leave. So I don't know if any of that was helpful.
Yeah, it's like Michael refers to it as the healing crisis. The perfect example of that for me a few years ago, my throat hurt. I mean, I couldn't even swallow water. It just was awful. And so Michael was breathing me and he's like, when did you feel this before? And I said, when I was 16 and had mono. And it kept on for a couple of days. And I mean, like, I wasn't even drinking water. So I went to see our physician and he gave me a saline drip to get me rehydrated. And they did a mono test because I said that's what it felt like. And the test came back that it was mono, but it was not active. So I was processing something that happened when I was 16. And, when we put energy in, it creates symptoms. And as we're healing and it's moving out, it creates the same symptoms. And if we get wrapped up in the symptoms and like, oh no, I've got mono, we can recreate it. Or we can say, oh, okay, the energy's moving out. This is a healing process and let it go. And I was better in just a couple days after that. Whereas when I had mono, it took like 2 or 3 weeks to get better. And so it felt the same. but it wasn't.
Yeah, it's a very good example. The which is a little interesting, or a lot interesting. When I was a sophomore in high school, which would have been about that age, about 15,
Yep.
I think. I also had mono, and
Yeah.
I created the experience of having mono, so I didn't have to address wrestling. I wanted to wrestle, but I didn't want to wrestle. So I got mono, and I couldn't, quote, couldn't. And so it was interesting, but that resonated when you shared that. So
Yeah.
my, whether it be a disease or dis-ease, being out of ease, or whether it be something that we've injured. I've just recently injured my wrist, as you were mentioning, Jeanie, and we did a very powerful healing process yesterday, and I've been working with it consciously and intentionally ever since it happened. Um, and it's interesting because I, I I started noticing that I was having less and less pain before yesterday. So I was gradually reducing the Tylenol I was taking and the aspirin I was taking. I take pure aspirin, 99.9, just aspirin powder. But what I noticed is I had almost little or no discomfort. And if I move, I can feel a little bit, I feel a sensation of discomfort, but not pain, right?
Right.
So I feel like, okay, what if this is healing? What if this is the remarkable body just regaining its awareness of self in its wholeness, and let it heal and allow it to heal and support it? And Michael recommended I do a mind shifter. I did it yesterday or today, and then I did some breathing yesterday, and just really being with the experience I'm having. And it's quite intriguing because I took a Tylenol 500 at 4 this morning. Mostly because I just thought, well, I'll take it. I don't think I really need it right now, but I'll take it anyway, just in case. And then I got up, and now it's going on 2 o'clock here, and it's I have no discomfort at all, and I haven't used
Awesome.
anything. So I'm using that as an example. So healing's happening all the time,
Yeah.
and I think what we do, Jeanie, and everyone, is that we have a tendency to inhibit the capacity of us as healers with our own bodies and with supporting others by our thoughts, feelings, and emotions. And one of the most repetitious thoughts and feelings that I've had is alarm or concern about it coming back or being here again. And I remember as a kid when I have disease of Kass-Perthes disease in my hip. Well, when I got the brace off, I would, if I had any pain in that hip, I would think, oh my gosh, it's coming back. I remember at 23, I had the pain started coming back again. So I went to see a doctor. I did some x-rays. They found I was, quote, osteoarthritic. And I addressed that naturopathically, nutritionally. But my point with that is that also can keep us bound to the experiences that we've had.
Yeah.
And doing the worksheets, addressing the goals. I reached a point where every single time I would find the next new thing that was going to work. And remarkably, there were times when it was gone. It was gone sometimes for a day, a week, sometimes even a month. When I first got exposed to Dr. Sarno's work, I didn't have back pain for a year and a half. And then it started gradually, I heard it doing this or heard it doing that. And then one thing led to another, and then it came back again. But it wasn't the back pain coming back. It was the repetition and the expectation that I still needed it or wanted it in some level or deserved it on some level. And that's where the forgiveness comes in and unraveling that. But
Right.
essentially, stop looking for something external that's going to cause it to change. I'm just going to encourage everyone to just consider that. When I stopped looking externally and I was just left with what I have, and I did a lot of things, very deep work on that. And what I realized is, wow, a lot of what I've been doing is to avoid feeling what I'm feeling. Well, then let me take that to the full level. Let's see what I'm
Right.
avoiding feeling with sadness and rejection and fear, and process through that. And So I hope that's helpful. I'm just trying to give you some of my experiences that I've had, over time. The worksheets are very powerful. Breathing is incredibly powerful. One of the main things I've found is the most beneficial for reoccurring symptomology is, rather than identifying with it as to something, as to who I am or what I'm experiencing, step back from it and observe it while experiencing it. And it almost always fades. And it's one of the recommendations I make when I'm working with someone, Jeanie, and I would just say, okay, so gotta, your shoulder's hurting. Let's just, put some energy there and feel the shoulder. And how's that feel? And so it feels better. Okay, good. All right. And then the shoulder would stop hurting, and then the big toe would start hurting.
Yeah, it moves.
Yeah. I go down the big toe and I put my hands on and say, okay, just breathe and feel the big toe and put your attention there. And how's that? She goes, it's better. It's better. Okay, good. And then the big toe would stop hurting, and then breathe for a little while longer. And then the, left hip would start hurting, and it travels. And it's because of what we're looking for. And rather than being caught up in the experience of what you're looking for, try stop looking and just being with. And I found that to be really helpful. And then I can get insights and intuition about what I might be able to address directly. And sometimes that is go see someone or go do something, but they aren't going to correct anything. They're going to support me, allowing my body and my being, my essence love, to correct what's there inside me.
Right. And you'll find too, like on your broken bone, as it heals itself, it will actually come back stronger because it builds, whether it's more calcium or whatever over top of the break, it'll
Right.
actually be stronger afterward.
Well, and that has been one of the statements I'm making in the visualization and the projection on my wrist, is that it's going to be even stronger. So thank you for verbalizing that. And doesn't it make sense? Because rather than creating a weak area, we'd want to have an area that wouldn't be susceptible to additional damage because it's already injured, right?
Right.
That would be a smart thing for the body to have that innately. It is cool.
Yeah, it is. It's
Yeah.
awesome.
Yeah.
Thank you for that. Absolutely.
Thank you.
Carrie, does that help or does it bring up more questions?
Yeah, thank you. It helps for some things, but so for example, one of the things that I have been struggling with is gout. And I don't even know how that process works in the body, but I had intense gout attacks for years, and it got so bad I would be in a gout attack probably 2 weeks out of every month, where I couldn't even walk to the bathroom. I had to crawl. And the pain was very bad, and I finally had surgery uh, on my big toe because I couldn't even wear shoes anymore. And then I went on medication then. So I haven't had any more episodes of gout since the medication. And I just would like to heal that, but I can't like be with it because I don't have those flare-ups anymore from the medication. So I don't even know where to start with that. But,
Well, your language would help, Carrie.
pardon?
If you were listening to what you were saying, it might be helpful.
Okay, what did I say?
I always love that about Michael. He shows me, oh, this is what I heard you say. Well, uh, one of the things that I've worked with the symptomology of arthritis in my kneecap and my right hip has been my right knee, it's very painful. I acknowledge that, and I was a witness to that as well, Carrie. So I acknowledge that it's very painful, and gout, is very hard to deal with. It's very similar to arthritic pain, as I understand it. And it is a type of arthritis, so to speak. But what I heard you talking about, it's very common language, but what I heard you saying is that you were being attacked by the gout. So what that mirrors is being a victim. And what I would do, having that thought in my mind and in my words, I would pause and say, when have I felt like a victim, literally or figuratively? And then do worksheets on that. And you
Well,
don't have to have the pain of the gout to remember what it felt like.
that's interesting because over the last couple of years, I've done a lot of work with victim consciousness, and um, I have felt transformed by that work.
Nice.
Yeah, and it's I don't I'm not um, tuned in, I guess, to that in terms of my gout. So I'll have to look at that a little bit more.
Well, and it could be, Carrie, realistically, that the idea of gout is what you may be working with. And what if you did the work and released the idea of victim, and in your languaging, because that's what we get into habits of language, like we do in our physical and mental and emotional patterns. You may have a habit of saying words that sound like a victim, and it resurfaces it. And what if the gout isn't there anymore? What if you don't have any symptomology of gout? See, I wouldn't know if my arm hurt if I just kept taking 4,000 milligrams of Tylenol a day. Do you understand what I'm saying?
Yeah, yeah. I guess the gout was so bad and it was so traumatizing that I'm not willing to just go off the medication and see what happens.
Yeah,
Um,
I wouldn't recommend that. I wouldn't
yeah.
recommend. But what I'm suggesting is if I didn't have the symptomology, then I would address whatever thoughts I have about having the symptomology.
Oh, I see. Yeah, yeah. I get it. Sure.
Yeah, and then you can just do the worksheets, and it'd be you, and maybe the object of your attention would be, the gout, and then the extreme pain, and whatever thoughts and the storyline, and you could do the worksheet. We don't have to have, Jeannie. I don't know if you ever knew this, but when I was working at the factory when I was a kid, I was in my early 30s. I took it upon myself. I was doing 6 worksheets. Let's see, no, 10. I started doing 6 worksheets an hour, and I worked up to 10 worksheets an hour. And I did them for 8 hours a day for a period of time. And I just had to make things up to do worksheets on it. I just wanted to explore the experience. So I did that for, well, I don't know, 3 to 6 months. And I just revisited that, the memory of that. I had stacks of worksheets. And you think, well, how would you do that when you're working? Well, I do a couple jobs, and then I'd get up the line a little bit, and I'd go back and I'd fill it out, and then I'd go back and do some more jobs. My reason for bringing it up is I did it as an exploration. You'll always have issues to do a worksheet on. Everyone does. So you'll never run out. And having severe pain that I've had and that I have recently had with my hand or my wrist, I actually have learned that I went back into the pain intentionally in my mind and went back through the experience and went through step by step of being thrown and jumping off the ladder, landing on my wrist, and the pain of the impact, and then rolling and looking up to make sure the tractor wasn't rolling on top of me, and then got up on my feet and did a real quick survey of my body, and my body was fine. I didn't feel any discomfort, only my wrist. And I looked at my wrist. It was kind of tweaked sideways a little bit. not not the way it looks normally. Well, I went back and I've done that 2 or 3 times. And the benefit of doing that is that I just revisit that and I breathe while it's happening. And I don't put in more trauma into the actual healing process. So you might kind of explore that with your gout as well, if you're inclined. Always follow your intuition. Don't listen to what I say. Just follow your gut and trust yourself.
And I looked up, I like Louise Hay. She does, she
Good.
has a list of what problems trigger. Actually, we did that yesterday with you, Rex.
Yeah.
She says gout is the need to dominate, impatience, and anger. So I want to look at those.
Okay, thank you. And I also looked at, I have that, but I also have that other book.
Yeah, I've got that too, that big one.
Yeah, that's been very useful, especially with the
What book?
QNRT.
What
Yes.
book is it?
Do you have it there, Jeanie?
Well, I thought I did. I thought it was laying right here, but it must be in there in the bedroom. Oh, what is it?
I'll get
Is
it.
it
I'll get it. I'll get it.
Because you're the one that actually, during the intensive, you had it, I think, with you. And then
Yeah,
Michael ordered it for me.
I was shown this book by Sandra Ray. She does the rebirthing breath work that I did for many years when I studied under her. And I had found it really, really useful.
remember the
So,
author?
yeah, I've got it right here. So it's called Messages from the Body.
Yeah.
And it's messages from the body, their psychological meaning. So Michael
Like
J.
that thick. It's huge.
It's a huge book, yeah. And it's by Michael J. Lincoln.
Huh.
And you get it. I don't know if you can get it at their website, which is talkinghearts.net. So you can order it there, talkinghearts.net. I don't know if that's where Michael got it, but
Yeah.
Let's see what it says in here about gout.
I've never had it, but Michael has. And I know anytime he has a flare up, he takes tart cherry. He's done the juice, but he also has like capsules.
Yeah, I tried that. That did nothing for
No.
me.
Also, I found through my first experience of osteoarthritis in my hip and my knee was when I was in my 20s. I was 23, and I adventured into the whole realm of diet and acidic, alkaline, the whole process there. And one of the things that I've found very consistent when it gets extreme, I just back off at any of the nightshade and I give my body a rest from it. And if I do it for, a period of time, then it's just the symptomology almost always goes away. In addition to that, I have always seen it in correlation with when I'm working on anger or
Yeah,
feeling
so
like
this is interesting because the things that you said, Louise Hay said, it's sort of similar. He says gout, hopelessness, rage, uh, feeling trapped,
yep,
learned helplessness, um, need to dominate.
It's very
Uh,
similar.
yep,
yeah,
seems
intensely judgmental, condemnatory, and rejecting. And I'm like, what? That doesn't sound like me at all. But okay, it's there, I guess. So,
Use that as
um,
a mind shifter and write the description as the mind shifter. And then on the
good.
other side, start writing, that doesn't sound like me. This isn't me. This isn't
yeah,
true. Whatever
yeah,
comes up. So use it as a mind shifter.
Yeah, I think I will do that. That's a great idea.
And what if
And
you lived, Mary, what if we lived 23 hours a day in non-judgment and only 1 hour a day we judged? And
yeah,
relative, relative to that 1 hour, that's a lot because we don't judge for 23. And my point of bringing it up is it's relative. Don't compare yourself to anyone else. You are your own being. You have your own, gauge, so to speak, as to what is more than optimal and what is less. And so just do it based on you. So if you don't find you're very judgmental at all, well, just be aware of the times you are.
well, I am judgmental, but it said intensely judgmental. I'm like,
Exactly.
what's the difference?
The person who spent 23 hours in peace and love that is judging for 1 hour would be feeling like that's massively
Yeah,
intense.
yeah, yeah.
Yeah.
So the other thing that I did do, I healed my thyroid,
Good.
um, because I went to several different endocrinologists or whatever, and they all said they couldn't help me because I did like a year and a half of blood tests and I was going from hypoglycemic and then hyperglycemic. So I get real shaky from being
Huh.
hyperglycemic and then I'd be hypoglycemic. And they said they can only treat one or the other. So have you heard of medical medium?
Of course. Yep.
Yeah. So I
We
did
got all.
Anthony Williams protocol for the thyroid and the liver cleansing. I did the thyroid healing thing and it worked like a treat. I've never had a problem since. So,
Oh, good for you. That's
yeah.
wonderful.
Yeah.
Well, Jeannie would say this, I'm sure, and Michael would as well. When I'm ready to heal, and the Course speaks about that, when I'm ready to heal, then healing happens. And
Mm,
getting ready to be ready, according to Abraham Hicks and her whole approach, Esther Hicks and Abraham, um, getting ready to be ready is when I can match the frequency of healing in my mind and body and have it be fluid and true for me, then it will happen. Because I'm the one that co-creates the healing by allowing it to happen.
yeah. Okay. Looks like I got some work to do.
Yeah,
Don't we
don't.
all?
That's what I said, Jeannie. I said, don't we? Yeah, yeah, we do.
I don't know why it popped up, but I remember Rex talking to you. I think it was back in 2021, and Michael and my dad and I all three got COVID.
Yes.
And
Yep.
you and I talked on the phone, and it was like, okay, so what's the thoughts and what's the feelings? And at that time, there were thousands of people dying from it. So I had this fear, and it gave me the opportunity to really look at my fear and to do a lot of worksheets around it and let it go. And yeah, I was really sick, but I moved through it and stronger afterwards. And actually, one of the things that happened is before I would have all this pain in the back of my neck, and actually had like a TENS machine, and I'd put it around my neck, and it would do the vibration back here and everything. And after COVID, I didn't have it at all. So it's like it healed my neck.
COVID healed you.
The COVID itself, I think, and doing all the work around the fear. But COVID was just a catalyst for me to look at, okay, what is it that is going on inside, that this is a manifestation, that you drew it in, because if we're like tuning forks. And so if we don't have resonance, Michael uses the example of a AM and a FM radio. And if
Yeah.
you've got it on AM, you're not going to pick up any of the FM signals. So if we have the resonance for it to draw it in, if we don't have it, then it'll pass on through, it'll be gone. So there was something that drew it to me for it to manifest in my body. And it gave me a great opportunity to look at the fear that I still held, not just about COVID, but about, life and death and, all kinds of things.
that happened when a few years ago when I was diagnosed with melanoma. That
Oh,
was
yeah.
all for me. It's addressing whatever is there, Jeannie, is what I'm hearing you say. And that's what we were
Yeah.
talking about. I remember that conversation. That was rough with your dad being sick and all of you having all that going on.
Yeah.
Yes, it's, you know, as simple as it can be, whatever I'm having an experience of is something that I'm having an experience of. And if I try to make it any more than that, it will be.
Yeah.
And so this sense I get from more and more experiences as I get older, I add digits to my years, is that what if I just approached life as a series of experiences and did everything from that perspective and did it as if I was a young child in awe.
Yeah.
And
What
so when I
lesson do I need to learn here?
yes, and when I went back and started revisiting the falling off the tractor, which happened just on Sunday, um, and I've been back, not back. I brought it forward to my current experience more accurately, and that's a big difference. But I have the memory and have the experience, and then bring it back to his current experience, and then I see more. I saw angels cushioning my fall. I saw, angels catching the tractor, and I wasn't in the presence of love in the moment consciously when I was falling because I was having an experience of falling. But I wasn't able to be fully present in the experience, but I must have been because I can bring it to my conscious awareness of all these other things that were happening simultaneously. And that comes from a lot of training and practice, but I think we're all capable of doing that. And
Yeah.
if I'm having an experience of something and I can actually neutralize and be as love, embracing it with the breath, with Ruka, and with all of the energies of love, then I don't have to have any repercussions from it.
Right.
It can just heal. Like we're designed to be. We're designed to be healed. I mean, we're not designed to have long lasting things. I think that's not innate, but I think it's something we've learned and figured out how to do.
Yeah. I agree.
Unraveling that crap. I'm done. I feel good with letting it go. So,
Awesome.
enjoyable conversation. Thank you.
Yeah, thank you for being here. Thanks for helping move it along. And thank you, Carrie, for your input. And Kathy, Susan, glad you all were here too. And we'll just say have an awesome weekend and we'll see you on Monday.
Sounds great. Thanks, Jeannie.
Bye bye.